All right, I want to thank everybody for being here today. I will warn you in advance, there's going to be a lot of detailed information. Be prepared to be writing down as much as you possibly can. I want to thank everybody for joining this process, and as well as thank our host here in Arlington for hosting this fabulous event. I will go more into this event momentarily, but I want to recognize Mayor Jeff Williams, County Judge Glenn Whitley, the Texas Health Resources CEO Barclay Burden. We got Fire Chief Don Croson, as well as Tarrant County Health Director Vinny Taneja, and who have I missed? Anyway, listen, I just had the opportunity to go inside and to visit this operation. And the way that everybody receiving the vaccination talked about it, they said they had never seen an operation run so effectively, so smoothly, so swiftly, and so easily. They said this is the easiest thing they have ever done going through this process. And so I want to applaud everybody with Arlington and Tarrant County for everything they did to streamline this process. The process used here in Arlington today is being replicated in many locations across the state of Texas, as I will go into shortly. But let me start out with this. Never before in the history of this state has Texas vaccinated so many people so quickly. Let's put this in context. It was 1 month ago this day that emergency use authorization was provided for the Pfizer vaccine. It was not until the middle part of the next week until the Pfizer vaccine was distributed and began to be used for Texans in the state. And in that first week, after the emergency use authorization was granted, only about 26,000 vaccines were administered. Then Friday of that next week, December the 18th, is when the Moderna vaccine was authorized. It wasn't until the middle part of Christmas week that the Moderna vaccine was actually being administered. And so when you look at the timeline of what's been done, all of the vaccines that have been distributed in the state of Texas has been only over the course of about 3.5 weeks. And so it's just astonishing when you realize that the fact that we've only been working for about 3.5 weeks to make vaccines available and to administer them, and then also doing so during the time of both Christmas and New Year's, it's stunning to see what we've accomplished. And what I want to do now is to run through some very important numbers about the number of vaccines that have been provided and administered, the ones that are still on hold, and what the incoming supplies look like. In just 3.5 weeks, the state has distributed 1,580,400 doses that have been shipped to providers across Texas. Of those, 800, and these are numbers effective today. You may have seen different numbers yesterday, but effective today, it's been reported to MTRAC that 802,507 of those doses have been administered to Texans. Of those, 83,538 are second doses. As you know, when you receive either the Pfizer or Moderna vaccine, you have a first dose, and then either 3 or 4 weeks later, you receive your second dose. Now, when you do all the math, you will see that there still remains, of those numbers that I provided to you, 777,897 doses that are either not yet reported or are waiting to be given to Texans. And I'll explain more about those numbers in a second. Importantly, however, separate from those numbers I just gave to you, and in addition to those numbers I just gave you, Texas has also provided 487,500 doses for nursing and for long-term care centers. CVS and Walgreens are in charge of administering those doses that Texas has provided them. As of last night, 75,312 of those doses have been reported being given to long-term care and nursing home residents. That means there are 412,188 of those doses for long-term care and nursing home residents that either have not yet been reported or are waiting to be given to long-term care residents. Now, importantly, all of these numbers are changing on a daily basis, sometimes during the middle part of a day. And so you may see some different numbers tonight. You definitely will see different numbers tomorrow as the numbers continue to flow in. It's like what you see with regard to the number of COVID cases and the number of people testing positive, et cetera. Those are numbers that change all day long, every single day. I wanted to give you a snapshot of where we are at this particular moment in time. I also want to explain to you why there is a differential between the number of doses that have been provided across the state and the number of doses that have actually been administered to Texans in the state. One is there is a reporting lag time. From the time that somebody is administered a dose, it typically takes about 2 days for that information to be inputted into the MTRAC system and for it to be received by the state and reported publicly by the state. Is very similar to the way the reporting data works with regard to people who test positive for COVID-19 and before that data is available for the state to report about the number of people who test positive. So my point is this: the number that we're providing to you today of the number of people who have been reported effective today that have received the vaccine is about 2 days behind. So you are going to see those numbers increase as it turns out somewhere between 50 and 75,000 per day. I do want to give you combined numbers. If you combine the numbers of the doses that have been distributed by the state of Texas, as well as the numbers that have been provided to long-term care and nursing home centers, here are the combined numbers of what has been done in Texas. Texas has provided 2,067,900 doses. And of that amount, there have been 877,815 Texans who have received doses of either the Pfizer or Moderna vaccines already. Now, there's another reason why there are some doses that are available that have not been provided to Texans. And we've been working with locations to try to reduce this number, and that is that there are some providers that have received doses that are holding doses so that they would be able to provide a second dose to the person that they gave the first dose to already. We've been working with the providers to help them understand they do not need to hold a second dose for the person they gave the first dose to, because we receive weekly additional doses of the vaccines. And it's those additional weekly doses of vaccines I'll be telling you more about shortly that are available for those people. And so we are urging anybody who is a provider who has any doses available where they may be holding that dose to provide for a second dose for someone to get that dose to a Texan immediately, knowing full well that you will be receiving your second dose very, very soon. And then another thing that we're finding is that the speed at which doses are being administered in nursing homes and long-term care centers by Walgreens and by CVS is moving at a far slower pace than what the state of Texas is moving at. And so we are strongly encouraging CVS and Walgreens to increase their pace, so much so that there was a telephone conference between the governors and Operation Warp Speed that had the leaders of CVS and Walgreens on that phone call at the time. And candidly, governors who spoke up during the course of that phone call from other states were adamant that CVS and Walgreens needed to accelerate the pace for the long-term care centers to make sure that the doses that are available for nursing home patients and long-term care center patients and residents will be getting those doses immediately. There is no reason for that process to be moving as slowly as it is. Well, all that said, the reason why we are here today at this location is because this is a part of our process, both as a state as well as working collaboratively with leaders at the local level to get even more doses out to Texans in an even swifter pace. In just the past few weeks, we've expanded the categories of Texans who are eligible for the vaccine. Category 1A, the first category, primarily focused on frontline healthcare providers and anybody else who works in the frontline category of providing healthcare in the state of Texas. As you know, we've now opened up an additional category, and that is anybody over the age of 65 or older, or people under the age of 65 who face or deal with certain chronic healthcare conditions that have been pre-identified. The reason for that is simple, and that is the math both in the state of Texas as well as across the country is there are two categories of people who are most likely to either lose their life or be hospitalized for severe consequences of COVID. And those are people who are age 65 and older, or people who are under the age of 65 who face these chronic healthcare conditions. And so by targeting the people that we are and providing the vaccinations to the people that we are providing it to are the people who are most likely to lose their life or face serious hospitalization. Because of the strategy that we're using, it should lead to a swifter decline in fatalities as well as a swifter decline in people being hospitalized because of COVID. We've also adopted strategies that will speed up the process of actually getting the vaccination administered to Texans. And that's what this event today is all about, is for us to showcase what Arlington is doing, but also what is being replicated in other facilities like this across the state of Texas. What we've done is we've shifted the model in just the past week, which is only 1 week of 3 that we've been administering the vaccine, but we've shifted the model from an extreme large number of vaccination distributors to a smaller number who have the capability of providing a extremely large number of vaccines very quickly. What this does is it creates the strategy of opening large-scale hub location vaccination centers exactly like this one. It allows communities to have several locations capable of vaccinating thousands of people in a single day. Across the state, there are 28 large-scale hub location vaccine centers like this. Importantly, in addition to those 28 large-scale hub vaccination centers, there are 206 smaller locations in smaller communities around the state. Each of these facilities will provide thousands of vaccines every single day, making the process far more quicker and far more efficient. And then in addition to those numbers I just gave you, providers in 104 counties will be receiving vaccines this week. Plus, providers in other counties will still be vaccinating with shipments that they previously received. I can tell you that residents of all 254 counties in the state of Texas have been vaccinated, and we work every single day on strategies to ensure that there will be a fair and equal distribution of vaccines to every region across the state of Texas. We have the structure to vaccinate Texans very swiftly. This structure that we now have created can be expanded and will be expanded very swiftly across the state. The only limitation that we now face is the limitation of supply. Supply of the vaccination is not something that the state of Texas is in control of. The supply of the vaccination comes only from the federal government, and for them it comes largely from the manufacturing capabilities of both Pfizer and Moderna. I want to let you know what our supply looks like. Each week this month, we are slated to receive, and this is on a weekly basis, we are slated to receive 310,000 first doses. And then in addition to those first doses each week, also each week, the state will be getting between 320,000 and 500,000 second doses. And so each week there will be 310,000 new people getting their very first dose, and between 320 and 500,000 people getting their second dose. And importantly, these numbers I just gave you, they do not count for the long-term care facilities or for nursing home facilities. Going forward, we do expect the weekly number of first doses to increase. And how much of that increase will be dependent upon the federal government. The biggest complaint that I hear with regard to the vaccination process is an inadequate supply, and believe me, I'm sympathetic to it because it's the biggest complaint that I also have. And the supply is totally up to the federal government, and we are urging them to get us more supply as quickly as possible. Right now, our focus remains on providing vaccines of both doses to healthcare workers, to people age 65 and older, and those with chronic medical conditions. Now, before I conclude my remarks, I want to add something else that's taking place as we speak today, both in Tarrant County as well as in other regions across the state of Texas. A goal that we have is to do everything possible to reduce hospitalizations. One tool to do that, obviously, are vaccinations. But we have another tool available to us to reduce hospitalizations, and those are these antibody therapeutic drugs like Regeneron. And so what the state of Texas is doing as we speak is we are working to open up antibody therapeutic drug administration centers across the state. Today, 2 are being opened in this region. 1 is being opened in Fort Worth. Another is being opened in Irving today. The state will be managing 13 sites like this across the state in the short term, looking to expand that even more as we go forward. This is in addition to the antibody administration locations that already exist at certain hospitals or other healthcare centers. These drugs are very important. I want to emphasize that these antibody therapeutic drugs like Regeneron, that's the drug that was taken by President Trump after he got COVID-19 and was able to recover from it so quickly. I know dozens of people who have received this antibody therapeutic drug, and they all say the same thing. They were shocked at how quickly they were able to overcome COVID after getting this drug. It's important because the people who most likely qualify for it are the people in the early stages of COVID. If you are in late stage COVID, it probably will not be available to you. The reason I tell you this, and that is if you are an early stage COVID patient, you should reach out to your doctor or other care provider that provides the Regeneron drug to see if you're eligible for it, and I strongly urge you to step up and make yourself available for this life-changing drug that can help you get COVID put behind you far more quickly, probably without the need to go to a hospital. I would now like to turn things over to the Commissioner for the Texas State Department of Health Services, and that is Dr. Hellerstedt.
Thank you, Governor Abbott. We have witnessed a really amazing operation here in terms of vaccination, and as the Governor has pointed out, our goal really is to vaccinate the people of Texas with all deliberate speed. So we have to do it right. We have to be accountable for it. We do have to have those data systems so that we know the dose has been given and we can track that, and when the person has time for the second dose, that we give the right dose to the right person. So having that kind of data available is absolutely essential, even if what it means is the numbers we see confirmed and reported in those systems is going to lag behind, but each day more and more is delivered. And through the kind of mass vaccination operation that we see here, we're very confident that it's going to accelerate even more. This effort, as the governor said, is unprecedented. We've never had to try and vaccinate every person in the state in as short a time as possible, but we're doing that, and we're doing that through the collaboration of the national leadership, state leadership, and especially local leadership and private-public partnerships. That's really what's getting it done. That's what you're seeing here, and it is really the way forward. It's quite remarkable. Please, though, have a sense of patience. We will be getting more vaccine. We will be discovering even better ways to administer the vaccine in a timely way to everyone who's willing to get it. But we just don't have that supply yet. I can't say that more emphatically. If we had more, there'd be more going out. We are not holding anything back at the state level in terms of our allotment. But this is a very bright ray of hope. This is the way to ultimately end the pandemic, and that is the thing that we all want. Thank you, Governor.
Thank you, Doctor. So the state effort to administer the vaccines and to distribute them is a combined effort of the Department of Health Services as well as the Texas Division of Emergency Management. And from TDEM, we have with us here today Josh Roberts.
Governor, thank you, sir. Our team at TDEM, we continue to distribute personal protective equipment to partners who need it all throughout the state. In fact, to date, we've sent more than 588 million PPE items to folks throughout the state. That's masks, gloves, gowns, face shields, and more, with 45 million of that or more coming here to the Dallas-Fort Worth area. We've got about 150 million of those items still on hand, with more coming in. And of course, as announced this past weekend, we've got the 2 regional infusion centers established in partnership with the North Central Texas Regional Advisory Council. As you mentioned, those centers are ready today to accept patients who meet the eligibility criteria and who have a physician's referral. As the vaccination efforts continue to expand, we certainly want folks to know that it's still important to keep up those preventative measures, to watch their distance, to wash their hands, to wear a mask, and to get tested. And we have today 77 state-operated public no-cost test sites around the state, with 19 of them open today here in the Dallas-Fort Worth area. And so we want to encourage folks to come get a test should they need a test. They can visit covidtest.tdem.texas.gov for more information. And finally, on behalf of Chief Kidd and the men and women of TDEM, I want to express our heartfelt thanks to the men and women on the front lines, our healthcare workers, our first responders, and many, many more, and to their families for the sacrifices that they make for the benefit of the public health and for the benefit of all of us. Thank you for the opportunity to come.
Very good. Thank you. Next, I would like to turn over to our host today, and that is the Mayor of Arlington, Texas, Jeff Williams.
Thank you, Governor. And of course, I need to start again by thanking you, Governor Abbott, and the state staff. They have been incredible. They stepped up when we first needed our testing back when this began, and then of course now coming through with the vaccines. Then I need to move to our county judge and the county staff. They have been incredible here in working together. And you see a pattern here: state, county, local, working together. And then I've also got to thank our hospitals. They have been phenomenal. Our frontline health workers have been incredible. And of course, we have Barclay Burdan with Texas Health, who is here today representing them, and of course based here in Arlington, also an incredible partner. So now you see the public-private partnership shaping up. Well, we knew that we had a challenge here because never before had we needed to vaccinate so many so quickly. Well, very proud of our fire department and our public health authority, led by Chief Don Krausen and Dr. Cynthia Simmons, who are right over here if you want to visit with them, because they were the architects of this site. This is a site that is customer service friendly. It actually is equipped with our fire department, our paramedics who care about people, have that hospitality there with them. But even more importantly, it increases the capacity here where our doctors and nurses can then be tending to so many of our citizens that have other health needs. And they have done an incredible job, because from the time they enter into the parking lot to the time they enter our esports stadium here in Arlington that we have dedicated to this, they are being taken care of. They are helped there to get into the facility. We have our wheelchairs and so forth there equipped, especially with this 1B category that we're treating right now. In addition to that, we help fill out the forms that they have, but then even more importantly, very much care to get the shots that are there to take care of that. But then in moving on to here with it, it's so important that we do work together. And of course the challenge here of getting the vaccines, but here our challenge here locally is to make sure that when the state sends those to us, that we immediately get those shots in the arms, because there's nothing more inspiring to see our citizens get vaccinated in there and the appreciation that they have. And again, so grateful there to our first responders who are doing an incredible job, especially here with our Arlington Fire Department. And now as we move forward, let us practice that generosity, that kindness here, and also patience and perseverance as we move through this. And let us spread the word to, yes, wear your mask. We need to get out of this, but also spread the word that we need to be vaccinated. And the testimonies of the people that have just gone through this is phenomenal. It is an easy process, but it can save lives, which is so important now. And here in Arlington, once again, we want to volunteer to help anyone, cities, counties, whatever, that would like to see the process that we have. Chief Krausen and Dr. Simmons are available here to share that, and we've had many already come through and tour the facility here, and we want to make ourselves available here to help whoever may need it. Thank you, Governor. Thank you, Judge. Thank you, Barkley. Appreciate Texas Health as we move forward to work together to vaccinate Texas. Thank you very much.
Thank you. And now for some very important additional information, we have County Judge Glenn Whitley.
Thank you, Governor. I want to just reiterate what has been said before. This has been a real collaboration of folks from the very beginning. Early on, our Public Health Department, City of Arlington, divided up the county. East side was taken by Arlington, west side by Public Health, and that was for our first responders. And then very early on, our governor recognized that we really needed to expand that to 1B, and when he did that, that just kind of significantly increased the volume that we were going to be having. And we knew immediately that our resource connection location was not going to be able to handle that by itself. And Arlington, just as they always have, stepped up, and that's what you see here today. They've got the capabilities of 2,000 plus folks on a daily basis, and they've done that. You heard the governor say that we want to get the vaccinations in the arms, and that's what we're doing. But what you also heard the governor say was he wanted Texans vaccinated. And that wasn't just Tarrant County Texans. That was Texans all over the state. And so Chief Kidd and I were talking, and he said, I want you to reach out. Will you help us get to the rest of Texas? And so last Friday, I talked with 10 county judges around Tarrant County, starting from Ellis, going out to Erath, Montague, and all the way up to Cook County. And we're registering them starting this weekend. We are registering them in the Tarrant County database, and they will be called in. Initially, they'll be called in here and given appointments to come and receive their vaccination. Eventually, we hope that we'll be able to take something out to them. And this was something that, you know, the state was very appreciative of, but at the same time, it's the right thing to do. And they just said, we've got to get all of Texas, not just the big urban counties, done. And that's what we're doing now. We're getting the shots and we're getting them in the arms, just as the governor said he wants them. You know, our goal is at the end of a week, we have no vaccines left. And that's more than just the hubs. You're going to hear in just a moment, THR, it is a public-private partnership. They're going to help with this process. We've got pharmacies, we've got clinics, JPS has got clinics. We've got every place we can. We want to get the vaccinations out and into people's arms. We're doing that because we've had such great cooperation with the state Department of Health Services, TDM. As was mentioned earlier, they're doing our tests. They've completely taken over and helping with that. So we can't thank the state enough. Governor, we appreciate everything your folks are doing to help us out here.
Thank you, Judge. And now to provide, again, more detail, we have the CEO of the Texas Health Resources, Barclay Burdan.
Thank you, Governor Abbott. I too want to add my thanks to you and your staff. Dr. Hellerstadt, you've provided great leadership as we've gone through these trying times. I also want to extend my thanks to County Judge Glenn Whitley, who's been a great partner for us as we've explored how we can respond to these challenges together. And in particular today to Mayor Jeff Williams, the City of Arlington, and particularly the Fire Department in Arlington, who have really stepped up to serve the community here in the eastern part of Tarrant County. Texas Health Resources is the largest health system in North Texas in terms of patients seen, and our corporate headquarters is right across the street from this facility across I-30. We're invested in the community. North Texas is the community we serve. And as we began to receive our allocations and focusing on the folks in 1A, we were able over the last 2.5 weeks to put about 20,000 doses in arms. And we have now begun to pivot to the 1B population at the direction of the state. And over the weekend, working with our friends from Tarrant Public Health, we designed a set of processes. We'll open up tomorrow 4 clinics around North Texas, around Tarrant County, 1 in the center of the county and 1 in each quadrant. And we are taking a download of about 7,000 patients, I think, who have registered on the Tarrant County website this week. We'll be reaching out to them and helping Tarrant County work down the list of people that are waiting on their website. So we're really delighted to really set the stage for this public-private partnership as we move forward. We'll begin to see how our plans are playing out this week, and assuming that everything runs smoothly, we'll begin looking at other ways that Texas Health Resources can extend out into the neighborhoods and other communities to serve the population of North Texas.
Thank you, Barclay. And now for some additional information, we have the Tarrant County Health Director, Vinny Teneja.
Thank you, Governor. Thank you, everybody. And I just wanted to add the comments that, as you can see, there's no shortage of leadership in the county and in our state, but the effort involves collaboration. And that is what is alive and on display here in Arlington. Our partners in the city of Arlington have done a great job in standing up this mega location. Capacity is 2,000 a day easy. If the push comes to shove, I think we can do a lot more here. But similar sites are being stood up across Tarrant County. You'll see another collaborative effort going into display tomorrow. We have a location standing up in Northeast Tarrant County. 14 partner cities and their fire departments are involved, and it's going to be at the Hearst Convention Center. Of course, everything's by appointment only. We don't want a mad crush of people coming to the site, but certainly we want it done in an orderly way. And more you'll see that we're starting to engage our partners in getting this task done. It is unprecedented to get every Texan vaccinated. As you heard from THR CEO, they've been a tremendous partner. We've already shared with them almost 7,000 people off our list so that we can start getting them vaccinated quicker instead of having to just wait in line on a list. So more and more partners will come on board. We're hoping that our centralized registry at www.tarrantcounty.com/COVID-shot, it becomes the central point of entry. You register there, and then we work with multiple partners to get you vaccinated as quickly as vaccine is available. So that's all I have, and again, thank you all for being here.
Thank you. We'll be happy to take a few questions.
Governor, a lot of the frustration around vaccines, the fact that there are these maps of showing providers vaccines who don't have vaccines, and the state's telling people to reach out to providers. We're saying don't
Well, there actually has been an improvement of communication and explanation about exactly what's going on. Remember again, this is something we've only been doing for 3.5 weeks. And what we were able to quickly learn over the course of the first 10 days is we needed to find a way to accelerate the process of providing those vaccines. And once that was done, a more effective communication system was set up. Vinny Tehai, as well as others have pointed out already. One thing that I learned today and have seen across the state, there are extremely effective communication platforms utilized by all of these large mass distribution hubs through the lines of setting up the format where people are able to sign up in advance and be able to access that. And then once again, in addition to that, there's extremely effective communication between the State Department of Health Services as well as the hundreds of other providers across the state of Texas. So we have multiple lines of communication that are breaking down any communication barrier, and that's exactly what we're trying to achieve today, and that is to provide everyone with very specific facts about where we are and exactly where we are going.
Governor, I want to ask you about two-part question. Given what happened at the U.S. Capitol last week, have you ordered that security be increased at the Texas Capitol for tomorrow, including the National Guard? And with regard to the budget, the comptroller announced today the revenue estimate. Have you been updated about that? What's your thoughts?
Well, first, with regard to security of the Capitol, listen, that's something that the Texas Department of Public Safety always remains on top of, and they will continue to remain on top of that. With regard to the budget, one thing that we all know, and that is 2020 has been a challenging year. We have been, we as in myself, the Lieutenant Governor, the Speaker, the person who is likely to become the next Speaker, as well as leaders of both Senate Finance and House Appropriations. This is something we've been working on going back to the summertime to make sure that we're prepared to deal with as we go into this session, as we look to the funds that are available to us to make sure that we will be able to continue to fund the current budget cycle that we are in, that ends at the end of August. But as you look forward, what you will see is that as we continue to accelerate the process of the vaccines, as we continue to slow hospitalizations and reduce fatalities, you're going to see the Texas economy engage very swiftly. Here's an easy example, and that is the price of the barrel of oil has doubled over the past few months. And that's something that not only is providing greater revenue for the state of Texas, but is also adding more jobs. That's just one example of a long list of examples of showing that when we get to the next budget cycle year that begins September 1 of this year, it means that we should be well positioned as we have in the past with a very robust economy. Some people are predicting an even faster growing economy in 2021 and 2022 than what we've seen in a long, long time. And so I think that we have tools and strategies to deal with budgetary challenges as a result of 2020, but for the next 2-year cycle, we should be looking to be in great shape.
Mr. Governor, obviously there is a well-concerted effort to a coordinated effort in the urban counties, Tarrant County, Dallas County, in administering the vaccines. What about in some of the more rural counties who may not have as many resources as the urban counties? How is the state going to be helping those more rural counties?
In multiple ways. First, you heard County Judge Glenn Whitley explain a strategy that is extremely effective. The county judge for Tarrant County is not just working to provide vaccinations for people in Tarrant County. He's working with the Texas Division of Emergency Management and the State Department of Health Services to work, is it 12 counties?
10 counties right now.
10 counties in the surrounding area, he pretty much all of which would be considered to be rural counties, to make sure that they will be benefiting from the strategies they have and make sure that they will be vaccinated. Separate from that, remember what I said earlier, and that is in addition to these large hubs that we have now set up, this week alone, there will be providers in 104 counties across the state of Texas, most of which will be in the mid to small/rural style counties that will be making sure that they will have vaccinations available for the people in their counties. And then on top of that, in counties that don't fall into those 104, many of those counties still have vaccines available to them to continue to provide to their residents. And importantly, like I said, residents in all 254 counties have received vaccines, and they will continue to receive those vaccines.
Is there some confusion? Can anyone sign up for one of these big hubs with, outside in Collin County? Can they sign up for Tarrant County?
So I have an answer to that. However, I think it would be better for me to turn it over to the people who are running this, and if I don't feel like they've covered it, I'll be happy to chime in.
What I would say is at this point in time, we've had people from Dallas, Denton, Tarrant, or Collin County who have registered and who have come here and got shots. Specifically right now, we are targeting those smaller counties. Dallas County's opened a spot today. Denton County is starting off with a mobile site, I believe, tomorrow. Not sure exactly what Collin County has done, but again, what I've done is to try to reach out to those smaller counties that, just as the governor has said, are a little bit more challenged as far as being able to set up a site. We'll get the vaccine out to them, or we'll invite them here in the beginning, and then eventually we hope we'll be able to go out to them and actually administer the vaccines within their area.
So let me just tell you this fact, and that is, a Texan is not limited to getting a vaccine only in the county in which they live. A Texan is capable and able to receive a vaccine in any county in the state of Texas. We do want to make it as convenient as possible for all Texans by making vaccines available as close as possible to where they live, which is why we have achieved vaccinations in all 254 counties. That said, if someone wants to come to Tarrant County or to Dallas County or some other county to get a vaccine, they are able to do so.
We know they'd much rather come to Tarrant County, Governor.
To President Trump's suspension from Twitter, and do you believe that he has recently incited any violence?
So first, with regard to the violence always obviously is unacceptable. But the people responsible for the violence are the people who did it, and they're the ones who should be punished for it. With regard to what is happening on social media, listen, typically any company has the right to make whatever decisions they wanted to with regard to who may use their product. However, what we have in some social media companies is different because they have been given a unique grant of civil liability immunity to maintain an open platform. And it seems like they're no longer complying with the open platform that allows them to receive the civil liability immunity. They cannot have it both ways. They cannot cancel conservative speech while still receiving that immunity. They're going to have to pick or choose which pathway they go down.
Governor, President Trump resigned. What do you think?
He's in office, what, another week? Listen, all the political machinations in Washington, D.C. About the last few days of his presidency are nothing more than political machinations. What Americans want to see out of the United States Congress, they want to see action. They want to see the United States Congress step it up and doing everything they can to provide more vaccines and make them available for people in Texas. We don't need them to do political infighting. They should be working every minute of every day, coming up with strategies that will create more vaccines for Texans and for Americans.
All right, thank you, President. Those are all the questions. Thank you.
Will Dupree here in the KXAN live studio coming to you from Austin. However, the live signal we're showing you right now is the end of a press conference in Arlington, Texas. Governor Greg Abbott and other officials talking there after touring a mass vaccination site for the COVID-19 vaccine in that community in Tarrant County. You heard from the mayor, the county judge there, and they are talking specifically about vaccine distribution here in Texas. A lot of people are complaining about how slowly the process has gone. As you see at the bottom of the screen there, only 2.78% of the population here in the state is partially vaccinated. That means they've only gotten the first out of 2 shots. And we do want to recount some of the things that the governor talked about there. He did say that a combined number of 2,067,900 doses of the vaccine have been provided so far by the state to providers out there all across Texas. And at this time, he said that 877,815 Texans have received a dose of the vaccine already. He did point out that when asked why this process has gone so slowly, he did point out that it has been fairly recent that the vaccines became available, saying that today marks a month since the Pfizer vaccine got the emergency use authorization from the Food and Drug Administration. He also said there is a reporting lag time, so when somebody gets the shot and then there is record of that sent to the state, there is some discrepancy in that, some lag, and that might contribute to the numbers. He also said that he would like the federal government to make more vaccines available because the state is relying upon the federal government to receive the shots in question. And at this time, he said that each week the state is slated to get 310,000 first doses and then additionally 320,000 to 500,000 second doses each week. Now, we do want to point out again that only about this time, if you take a look at this graphic right here, let me pull that up for you all. At the bottom, in the yellow box on the right-hand side, let's take a look at that full screen. Only less than 1% are fully vaccinated, meaning they've gotten those 2 doses of the COVID-19 vaccine, and approaching 3% of the Texas population have been partially vaccinated. The governor also discussed a change in strategy in terms of what sites will be getting the vaccines here. This week, they've opened and designated 28 what are called large-scale hub vaccination centers. And one of them was where they were today in Arlington, there at the Arlington Expo Center. And there are these sites pointed out in 28 places all across the state. And what these are exactly is that they can provide more than 100,000 people with vaccinations during a period of time and provide it to people who are at greater risk of hospitalization and death, as well as frontline healthcare workers. This is a little bit different. He did say that there are going to be providers in 104 counties in Texas that will receive shots this week, but for right now, those 28 locations are receiving the lion's share of the vaccines because they have the capability to vaccinate a larger amount of people at one time. So we are still following all of this. You can find more information on our website. That's kxan.com or on the KXAN News app, so please download that. It does not hurt to mention as well that even though it may take a while for vaccines to become widely available to everybody, the easiest thing to do right now is to wear your mask in public because that protects yourself and others from getting COVID-19. We are in a tough spot right now here in our state because hospitalizations are climbing. Active cases are at a record amount at this point. More than 13,000 people are currently in the hospital in Texas battling the disease caused by the novel coronavirus. So doing any of those kind of preventative measures will really pay dividends at this moment. So that means wear your mask, socially distance, only gather with people in your household, wash your hands. These are things that have been said for months now since this pandemic began, and it has not been more important than it is right now because we're seeing this surge all across the state. So I urge you all to please be safe, be healthy, be careful, and we'll see you back here another time. Take care.